Let's bring in infectious disease specialist and ABC News contributor, Dr. John Brownstein, now for more on this. Dr. Brownstein, good morning. What do you think when you see those airport images from the past few days?
Yeah, hi, Dan. I mean, this makes me incredibly nervous. I mean, the sheer numbers of people that are looking to gather outside their household, there's no question this is going to be a super spreader event. We know every single time we have a holiday, we see increase in mobility, and that leads to increases in cases. And this is the most travelers we have seen yet. And we're already in a crisis mode with this pandemic, right? Widespread surges, healthcare systems on the brink of collapse. I mean, we're probably going to be at 200,000 cases a day leading into this week, 200,000 in hospitals, maybe 2,000 deaths a day. I mean, if you start looking at these curves of this epidemic, they're nearly vertical right now. So all I can say is if people can reconsider their plans, try to keep those gatherings small and to their households, we can actually make a dent into this grim forecast. And just a note on testing, I know people think they can test their way into Thanksgiving dinner. That is not true. A negative test doesn't mean you're not infected. You could be pre-viral, load that would be detected by a test. So we really have to understand it's not just about testing. It's about gatherings that are small, masking, social distancing, ventilation, everything we can do to keep transmission down heading into this holiday.
If people have to travel, what's the safest way to do it, aside from obviously just being in your own car?
Right. I mean, truthfully, you want to avoid it all, right? So any scenario carries some risk. Travel in itself, maybe it's not the riskiest, but it's the things around the edges, right? The airports, the bus terminals, the rest stops, all of these carry some risk because you can't stay 6 feet apart. Plane probably has more risk just because you're connected to more people. So hopefully you have nobody in the middle seat and you're on the window side. But cars, if you're not in a bubble, that carries risk as well, right? If you're carpooling or people outside your household, there's opportunities for transmission. So clearly masking and keeping the windows open is the most important thing you can do if you must get into a vehicle and travel this Thanksgiving.
AstraZeneca and Oxford University announced that their trials show their vaccine is up to 90% effective at preventing the virus. How does it compare to the Pfizer and the Moderna vaccines?
Yeah, so Monday, another incredible day for vaccine news. We now have a third vaccine candidate, which is showing signs of being highly effective. This is the AstraZeneca vaccine, which is actually a totally different mechanism from the other two vaccines. It's using what's called an adenovirus that can actually help to deliver genetic material. So totally different technology, but also showing efficacy. Overall results were about 70%, but they used two scenarios, one which is 2 full doses of vaccine and one which was a half dose followed by a full dose. We're not exactly sure why that second scenario did better, maybe because it doesn't create an immune response to that adenovirus, but the efficacy of that version, that scenario was 90%. And on top of that, we saw no hospitalizations, no severe cases, and also, super importantly, no severe adverse events. So still some really wonderful news when it comes to this third vaccine.
We'll take the wonderful news that we can get. We also know that frontline workers will get access to vaccines first. How will other Americans know when it's their turn?
Yeah, I mean, listen, we know that there are going to be some priority groups when it comes to this vaccine, healthcare workers, the vulnerable. We're seeing potentially 20 million doses by the end of December. Hopefully, we're going to have a real ramp up in production into next year. And that's why it's so great about this AstraZeneca vaccine, because they have the potential to create 3 billion doses by 2021. Also, what's amazing is that there's going to be equitable access across this globe on top of being available to most Americans. So now you throw in a third vaccine, you have improved manufacturing. This particular vaccine actually doesn't require deep freezing. It's just regular refrigerators, so much more transportable. So again, this ups the game in terms of being able to deliver vaccines to most Americans early into next year.
And then we heard in Tom's piece that Regeneron therapeutic was approved for emergency authorization by the FDA. What do we know about that?
Yeah, I mean, listen, it's great. It's another therapy that's being made available to the public. Clearly, the president received it, and that may have had a real impact. The clinical trials around this therapy are incredibly promising. The caveat I'll mention is that there's still going to be a supply issue, right? These therapeutics were not meant to scale to millions and millions of doses, so there'll be a subset, and clearly they will be helpful for those with severe COVID. But it's not going to be a therapeutic that is going to get us out of the current grim situation that we're in now. So we really can't count on therapeutics to get through to the end of the year. And this is why it's all about the non-pharmaceutical interventions like mask wearing and social distancing, all the boring stuff, but we know it works so well.
All right, Dr. John Brownstein, we appreciate your time as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.